Today we are going to see the demonstration of primary impression for the complete denture. To start with, we are going to see the armamentarium for this procedure. Here you could see the impression trace. This is like LC1, 2, 3 and 4. According to the diameter, we will just decide upon which of the trays to be used. And this is the impression compound. You can use alginate also for making primary impression. This is used for secondary impression. This is a low fusing compound, and this is for border molding, and this is a non-eugenol impression paste which is used for secondary impression. This is the rubber ball which we use to have the hot water. Since it's a thermoplastic material, we are going to soften it using the hot water. These are all the other armamentariums which are used. You will be seeing it in the procedure.
Today we are going to see about the steps for primary impression for complete denture. So the first step in this procedure is you have to select the impression tray for making the impression. So as you people know, impression trays are two types. One is a ready-made one, that is called stock tray, and one more is called customized tray, that is called special tray. So for primary impression, we are going to use this stock tray for making the primary impression. So in the procedure of tray selection, first you have to select the upper tray followed by the lower tray for the impression making. So in this step, the important thing is first you have to make the patient to sit in upright position, and the operator has to stand in right hand to the patient and in the front position for the patient. So for selecting a tray, you have to select the width of the upper alveolar ridge. So corresponding to that, you have to choose the tray. So tentatively, by seeing the ridge, I am choosing this U2 tray, and I am going to see whether the size is suitable for the particular patient. So what we can use, you can use the divider to measure the width between the two alveolar ridge, and you can overlap on the tray size for selecting the suitable tray. So while placing the tray, first you have to retract the patient cheeks by using the mouth mirror. You have to place it on the patient's right side of the corner of the mouth, and you have to retract it. At the same time, you have to insert the tray by pushing the other side of the corner of the mouth, and you have to rotate it, and then you have to seat it in the patient mouth. After seating it, you can, using the mouth mirror, you can reflect the cheek tissues and you can seat the tray. After seating, you have to verify that whether the posterior extension is covered properly, covering the pteriomaxillary notch and also the vibrating line, that is the posterior vibrating line. And then you have to see whether the sulcus is being covered, the buccal sulcus and the labial sulcus, and also the frenum. And make sure that there should be about 3 to 5 mm of gap between the tray and the alveolar ridge. That's a space for the impression material to flow and record. So this tray is suitable for this patient. It's covering all the peripheral limits. So in case if there is any excess gap between the flange of the impression tray and to the alveolar ridge, it's more than 5 mm, then what we have to do, using this plier, universal plier, you can bend it and adapt it in the particular region wherever it is required. And one more situation where there is an excess amount of height of this flange, it's impinging on the vestibule, then you can trim the excess as well. And for instance, where there is a shortage of the posterior extension of the tray, it's not covering the posterior vibrating line, what we can do, if you are using an impression compound, you can use self-cure impression material to extend this tray border. And in case we are using the irreversible hydrocolloid, then you can use modeling wax to extend the posterior extension of the tray. The same can be applied for the mandible also. For deficient trays or over extension trays, you can modify the peripheries of the trays. Now we are going to see the tray selection for the mandibular arch. Make sure the patient is seated upright, and operator has to stand in front. In case with the left hand operator, the operator has to stand on the opposite side. And you have to reflect the cheek muscles on the right side, and you have to insert the tray by rotating it, and then you can center the tray onto the or to the alveolar ridge. After placing it, you have to see the peripheral limit. As I mentioned, for maxilla, for mandible, it has to cover for the retromolar pad buccal shelf area, and for the labial and buccal vestibules, and for lingual it should cover the lingual sulcus, and also the distal lingual sulcus it has to extend properly without impinging on the soft tissues. And you have to slightly raise this tray, and you have to see whether it is properly seated, and you have to reflect the soft tissue and check whether there is a 3 to 5 mm gap between the alveolar ridge and to the border of the flange. So this tray is also suiting perfectly for this patient. So now we are going to see the impression making. So based on this patient's edentulous ridge and also soft tissue, I have chosen this impression compound for making the primary impression. In case if there is an excessive undercut and also unsupported tissues, then you have to choose for the irreversible hydrochloride, that is alginate. So for making the impression compound to be ready for making impression, we have to break the impression compound into pieces for easy softening of the material, and you have to put this impression compound in the gauze to avoid sticking of the impression compound to the bowl. And make sure that the hot water has to minimum of 140 degrees centigrade, that is 140 degree Fahrenheit. So the softening temperature is minimum of 132 degrees Fahrenheit. So allow the material to be softened in hot water. And here the advantage of hot water is it is acting as a plasticizer. It will help the material to flow properly. So make sure that while kneading this impression material, the material has to be in the water, not outside the water. Have taken one cake of impression compound. So based on the size of the impression that is going to be made, that is based on the size what you have chosen, the tray size, you have to choose the material also. If it is L3 or U3, then you have to take more than 1.5 cake. Since here it's a U2, I am taking the one cake itself. So the material is now pliable, so I am going to knead the material adequately. So I made it into a uniform mass. So I am going to adapt this material onto the impression tray. So after adapting it, you have to make sure that it has to cover the entire tray, and also some amount of pre-molding is required. Otherwise the material will not flow as similar to that of the alginate. So since it is a rigid material, we have to pre-shape it for the better impression. So now I have made a groove corresponding to the alveolar ridge. So if the temperature is more, then what we can do? We can do tempering. That is flaming it with the Bunsen burner or the micro torch, then you can dip it in the hot water to prevent the burning of the soft tissues. So now I have made it. So now I'm going to make the impression. So as I mentioned, we have to reflect the cheeks with the left hand of the right side of the patient, and then you have to rotate this impression tray into the patient mouth, and you have to center it on the alveolar ridge. So after placing it inside, you have to apply the seating pressure. During this posture, you can go behind the patient, so it will be comfortable for the operator. After seating it, then you have to apply the seating pressure till it reaches the desired vestibular depth. Ask the patient to relax the lips, and then you have to hold the tray with one hand and you have to mold the other side. And similarly, you have to change the hand and hold with the other hand, and then you have to record the mold the other side. And ask the patient to bend forward. Bend forward. So by which we are activating the soft palate to descend down. So by which we are going to record the posterior palatal seal area better. Now we have to hold the tray in position to avoid distortion of the impression. We have to allow the impression material to become set, that is become rigid. The advantage of this impression compound is it allows for minor correction also if it is required in the deficient areas. But in case of irreversible hydrocolloid, we have to take multiple impressions to make a perfect impression. Just inspect the impression material whether it has become hard or still soft. Now I could see it's become hard. So I am going to remove the impression from the patient mouth. Make the patient head supported while removing it. Just release the peripheral borders. Slightly ask the patient to slightly close the mouth, because it will make the soft tissue flaccid. And then now you have to remove the single stroke. Now you can see the impression has been recorded properly. If there is any area is deficient, you can add it in incremental way, and then you can remold it. Now we are going to make impression for mandible. So I am adapting the impression compound over the selected impression tray. So I am slightly pre-molding it for better flow and as well as for better impression. So I am making this slight groove in the center of the tray. So now the impression is ready, material is ready. So I am going to make the impression. So the operator has to stand in front of the patient and you have to reflect the soft tissue at the corner of the cheek. Then you have to rotate the tray into the patient mouth, and you have to center the impression onto the center of the alveolar ridge. So after placing it, you have to make sure that it has to be positioned correctly onto the alveolar ridge, and you have to applying the seating pressure. Ask the patient to protrude the tongue outside. And holding the tray with one hand, you have to mold the borders of the cheeks. Similarly, hold with the other hand and then record on the other side. And the lingual aspect is mainly recorded by the patient tongue movement. Ask the patient to wipe the upper lips. Ask the patient to bite, and then you have to exert the downward pressure onto the impression tray. This is mainly to record the mesotic notch on the distal upper surface of the impression. Now the material is become hard, it's set. So now we can remove the impression from the patient mouth. So this is the impression. So if there is any deficient, you can add in the segmental way and you can remold it. And if excess also, you can trim it and then you can remold the particular border.